Hello, and welcome to today's webinar, HeForShe, How to Be a Champion, hosted by the International Relations Committee. This is part 2 of a 2-part series on championship in surgery. My name is Jessie Von Custer. I am the committee administrator for the IRC. Before we get started, I wanted to inform everyone that the webinar will be recorded and will be available for viewing on the ACS YouTube page after the webinar. Additionally, if you have any questions during the webinar, you may submit them through the Q&A box at the bottom of your screen, as there will be a Q&A portion at the end of the webinar. With that, I am pleased to introduce you to today's moderator, Dr. Kazumi Kawase. Dr. Kawase is a professor of the Department of Surgery at the Jeikei University School of Medicine in Tokyo, Japan. She's the co-founder of the Japan Association of Women Surgeons. She's a past committee member of the ACS Women in Surgery Committee and the International Relations Committee, including being the past chair of the IRC Women in International Surgery Subcommittee. With that, I will now turn over to Dr. Kawase. Dr. Kawase.
Hey. Hello. Thank you for joining us today for the ACS International Relations Committee webinar, HeForShe, How to Be a Champion. The purpose of this webinar series is how to promote HeForShe for mainly international women surgeons and their surroundings. This year's IRC Women in Surgery HeForShe webinar is 2-part series. Part 1 was held on September 24. First, I would like to mention discussions from the last webinar. In part 1, a championship or sponsorship in surgery was described as an intentional way of helping those around us to promote their career, and has a voice to somebody that speaks for you when you're not in the room. And championship or sponsorship were more action-oriented relationship than mentorship. So in part 2, we would like to learn from leaders worldwide about how to provide championship sponsorship to women surgeons to best support their careers. We are going to discuss strategies to create the best experience for both the champion and the surgeon they champion. Now I'm really excited to have this webinar. This session is a moderated Q&A discussion with an experienced panel to discuss the things I mentioned. After the moderated discussion, we will have an audience Q&A, during which the panelists will answer audience questions. If you have any questions, please make sure to submit them through the Q&A panel. With that, it is my pleasure to introduce you to today's panelists. First, I welcome Dr. Stephen Wexner. Dr. Wexner is the director of the Ellen Leifer Shulman and Stephen Shulman Digestive Disease Center. Dr. Wexner was vice chair of the Board of Regents, the inaugural chair of the ACS Commission on Cancer National Accreditation Program for Rectal Cancer, and a member of the COC Executive Committee. Dr. Wexner is a past president of the American Society of Colon and Rectal Surgeons, the American Board of Colon and Rectal Surgery, and the Society of American Gastrointestinal and Endoscopic Surgeons. Dr. Wexner has published over 1,000 peer-reviewed manuscripts and is an editor-in-chief of surgery. He has an age index of 100 and is currently the most cited living colorectal surgeon. So, next, I welcome Dr. Peggy De Silva. Dr. De Silva is a vascular and endovascular surgeon who practices in Sydney. She is the chair of Women in Surgery Committee for the Royal Australian College of Surgeons, as well as the chair of the New South Wales State Committee for RSES. She is the clinical director of surgical services and the head of the vascular surgery department at the Sydney Adventist Hospital. He is a visiting medical officer and the chair of the Staff Medical Council at Hornsby Ku-ring-gai Hospital. Now that we have introduced our panel for today, I will now begin with our first question. So at first, please tell us your thoughts about how important to promote championship to women and minority surgeons, both in domestic and international. What are the advantages to the system in promoting women and minorities? So please go ahead, Dr. Wexner.
Thank you very much. It's an honor to be here with you and with Dr. De Silva. Thanks to you and to the American College of Surgeons for including me. I'm very proud of the role that I've had in being an ally and sponsor and championing not just women, but other underrepresented minorities in medicine in the U.S. and abroad. I think it's essential for many reasons. I mean, number one is to give people an opportunity themselves to best their careers, to advance their careers, and to have every opportunity to succeed in their careers. It goes beyond the individual practitioners. It's good for the department or the society or the journal or the meeting, whatever happens to be the form it's taking in which we need to have representation. But also for the patients, right? When you're talking about a healthcare delivery system, having people in leadership roles and having people engaged is very important. It's been shown by many studies. When we're talking about women in particular, different levels of empathy and different levels of performance, which are superior in many of those studies to their male counterparts. In addition, patients as well as younger trainees tend to feel very comfortable, perhaps more comfortable, when somebody looks like them and has a similar background to them. So it behooves us to ensure that patients, trainees, others have access to people who look like them. And in this case, for today's webinar, we're talking about women. So the entire system benefits, society benefits. And there are many studies extending well beyond surgery and beyond medicine into other industries showing that a diverse workforce is a more productive, more beneficial workforce than a homogeneous workforce. Many studies have shown that point.
Okay, so we have to accept different level and all diversity. Thank you. Dr. De Silva, please.
Thank you. It's a great honor to be here. I totally agree with what Dr. Wexner said. I think it's really important to remember that we are surgeons for our patients, and all of our patients are different. And patients feel comfortable with different types of surgeons. And you can't expect patients to want to go and see the people, who may look very different to them. In Australia, we're a really multicultural society. And so it's really important to have surgeons that, come from different cultures, speak different languages. For women, we know that studies have shown that if you're a female patient, that you will actually have lower complications with a female surgeon. So, one of my favorite things that I like to say is if we're talking about patient safety, how much improvement will there be to patient safety if we actually have 50% of surgeons being women? So I think that's a really important thing, that we want to actually promote the best outcome for our patients. And the way that we can do that is to make sure that we have surgeons that reflect our society. And so that's why it's really important to have gender equity and to have diversity. I think that's a really important thing, and I think we acknowledge that everywhere, but it's really difficult to put it into action, because to actually do that and to actually promote women, it's very hard. And I think in a society where men have always had a little bit of an advantage, when you say to somebody that we want to change things, it suddenly makes them feel like they're being disadvantaged. And so that's a bit difficult. So I think it's really important as women that we have men like Dr. Wexner who are joining us, because, I always say that I became a surgeon because I had really great male mentors who helped me. And so for that reason, it's important that they come along, because it's because of them. At the moment, they're in the majority. They're the ones who are going to help us to become more equitable in the future.
If I might add, that part of what we've needed to do is not just promote individual people, but change the system to make it more hospitable, more welcoming to women surgeons. Things that didn't exist. I mean, the work-life balance didn't exist as a term when I was a trainee. Certainly, there were no such things as parental leave. You know, things the way that they're discussed now. All manner of things that you have to be able to make people feel welcome. You can't make them feel excluded, and you certainly can't penalize people for needing to do what they need to do. If it's getting their kids to school before the end of the day, or getting out to collect them at the end of the day, or suddenly needing to be out for a school play or a doctor's appointment with your kid. Those things didn't exist, you know, when I was a trainee or a young surgeon, and we've become acutely aware, and the American College of Surgeons has taken tremendous steps in publishing numerous white papers and in working with the American Surgical Association and the American Board of Surgery to ensure that those changes are baked into our system, at least in the US, and therefore in other parts of the world, because many people emulate what we do or reproduce what we do, and some people may undoubtedly be ahead of us. But in any event, you know, the ACS has been a tremendous champion of ensuring that these issues are recognized, and not just recognized, but then acted upon, right? Because to promote somebody into an environment that's not a friendly, welcoming environment is going to be kind of a self-fulfilling prophecy of failure. But promoting people into an environment that is welcoming and accommodating to needs, which are diverse as you mentioned, Dr. De Silva, patient population. Different people have different needs, and we need to be respectful. And that's been a big change that we as allies and have been able to put into the system, going beyond individual trainees and staff.
Yes. So changing system is also very different. Okay. So
Essential.
would you tell us about your experience, how you promote championship to women and other minority surgeons? Can you give us a specific example?
Will I start with that one? I
Yes.
think
Yeah.
so in the College of Surgeons, through the Women in Surgery Committee, we've actually brought in flexible training for all of our surgical specialties. So that means that any trainee, male or female, that applies to do flexible training should be given that opportunity, which means that the first year that we actually brought this in, we had 15 positions. And interestingly, 8 went to women and the remainder went to men. So it just shows you that when you bring in flexible training, it's not just for women, it's for the whole trainees. So, you know, for people that may be wanting to do some research, or they have parenting roles, or maybe a sick parent, or themselves may have some illness or something that they can't work full time. It's been really great. So that's one of the things that we've done. We've certainly brought in breastfeeding policies for women who've had babies and want to come back to work, because, you know, you have to have a fridge, you have to have a facility to breastfeed or to pump. We've brought in, we're looking at the moment a return to work policy for people who have had time off, because, you know, you can't expect someone to have taken time off and then suddenly come straight back into work. One of the other things we're looking at is sort of what we expect our pregnant trainees to do, because we know that in the 3rd trimester that you can't expect someone to work at the same rate, perhaps, due to just increased risks of pregnancy loss and intrauterine growth retardation. So it's really important that we also look after our trainees. It's such a short period of time for a very long career. So I think it's really important to encourage women, and you have to do this by having these policies, because, you know, most of us, when we go into training, that's when we're all fertile. That's when we're all going to have babies. So it's really important that we try and support that, because we know that once we've had our kids, that's when we're all going to work really hard and, you know, have long careers. And so it's really important to try and bring those systemic changes in.
Yeah, key points, absolutely key, and it's you know, certainly in concert with what I mentioned earlier about changing the work environment from what it used to be to what it needs to be. On a personal level, I'm very, again, proud of many of the things I've done, from you know, training and hiring a lot of women here at Cleveland Clinic, Florida, leaders throughout the world, people who've trained with me who are now leaders here in the U.S., in other countries, who I've helped as they've gone along their career journeys to find jobs as department chairs and division chairs and program directors. When I was on the nominating committee of both SAGES and ASCRS, after I was president of each one, being able to put women in line for presidency of those organizations. Certainly with the journal, which you mentioned, Surgery, that I'm one of two editors in chief. We just completed our search, and I'm proud to say that in the entire 80+ year history of the journal and from its inception, we now will have our first woman as an editor-in-chief. Dr. Caitlin Hicks from Johns Hopkins will be joining me. I've done a lot on the Advances in Surgery channel with monthly inclusivity broadcasts, and I've been able to feature the Society of Black Academic Surgeons, the Latino Surgical Society, the Society of Asian Academic Surgeons, the Association of Women Surgeons, the Association of ALPS Surgeons and Allies. And in fact, I've become members of societies, personal, institutional, whatever, to stay engaged. I'm delighted that they recently made me an honorary fellow of the Society of Black Academic Surgeons. I've helped these groups publish the things they're doing, and not just in surgery, in other journals, American Journal of Surgery, and others, to get the word out there and get the message and celebrate what they've done. I find social media is another great way to do it, that I'm very active on X, Twitter, perhaps somewhat less so on Facebook and LinkedIn and Instagram, but celebrating what women, underrepresented minorities, again, either as individuals, particularly my alumni, which are plentiful, or on a society level, what they've done, and celebrating their victories and promoting their meetings and promoting the cause. Every little bit helps.
Yeah, that's great. How can a champion or sponsor provide access to new opportunities for surgeons, especially for women and minority in the very conservative environment? If you're in a high-level influential position and have a voice, it seems easy to give other person various opportunities. But if you're not, how do you promote younger surgeons, especially women as a minority in surgery? For example, in the very conservative surgical society with patriarchal masculinity. How do you think, Dr. Wexner?
Okay, I can certainly take that one first. Some of the things I've certainly mentioned, when you're in a position to put someone on a committee, when you're creating educational content on a scientific forum, whether it's at the American College of Surgeons, whether it's the annual colorectal meeting I run in Fort Lauderdale, whether it's for any society, that you ensure that you have a balanced program, and balance obviously includes representation of underrepresented minorities, representation of women. From my view, one of the things I started doing early on in 1990, when it was virtually unheard of, is inviting faculty from places like Latin America and Eastern Europe and Central Europe, and places where people generally weren't invited to the podium in the US, and getting people featured from around the world. I think that's very important. I think giving people an opportunity to speak at meetings, to publish, to participate in committees, and that's on a local level too, on a hospital, university, department level, ensuring that you're promoting people into positions, but make sure it's something they want to do, right? Just giving somebody a job, if it's not something for which they have a passion or an interest, isn't really doing them a favor. So if somebody's interest isn't in speaking, don't ask them to speak. But if somebody may have an interest in creating a video or whatever it happens to be, just find what ignites their fire and ensure that they're going to have the opportunity to kindle that spark and keep going. But be sure it's in sync, because it's kind of like coaching is asset-based coaching. It's not my assets, it's the coachee's assets, right? What do they want to develop? And as we said earlier, with things like parental leave and breastfeeding and work-life balance, their views are going to be different than mine. I accept that, I applaud that, and have to be sensitive to it. So the first thing is listen. You know, what is it you want to accomplish? What is it you want to do? And then figure out how to get you there.
Okay.
I think
So
that
you-
so I'll probably answer that question. I think especially coming from when you're in society where perhaps it is very patriarchal, I think the first thing that's really important to do is, you know, when Dr. Wexner talked about social media, I think that's really important. When you have a small group of women, it's really important to be in touch. And that's why women's societies are really important. Because when you have that sort of collegiate group, it's very easy to feel isolated if you're the only female in a department. And it's really great to be able to make those connections with other surgeons in the area. And, you know, in different countries, you'll have different issues that you know, it's great to have an international collaboration, but it's also important to have that local collaboration because you'll have different viewpoints of things. I think one of the things that for me out of COVID that was great is these sort of WhatsApp groups that have sprung up around the place. And, you know, I'm a member of, you know, a couple of international vascular WhatsApp groups, which is amazing because I've suddenly come in contact with so many people that I probably wouldn't have come in touch with previously. And so that's really important to actually utilize those things and to really have those conversations that sometimes you might want to ask questions that you don't want to ask in front of a whole bunch of people, but you might ask on a female only group. So I think that's the first step is to have that safe space where you can ask questions, where you can talk about different issues. How would you handle that? You know, that person said this to me. What do you think I could have said back to them? So I think that's the first thing is to understand that, you know, it's important to have that backup to know that you're not alone, you're not facing this sort of isolation by yourself. And then the second thing I think is to really find who your allies are. And I think that that's really important because you'll know who they are and you'll know who they're not. And the people that are your allies, they're the ones that you need to go to. And just like Dr. Wexner was saying, you need to go and tell them. And sometimes I think women, we tend to be a bit shy. And it's important to go and say to somebody, look, I'd really appreciate that opportunity to speak at that conference. Or, you know, I'm really interested in doing this research. You know, would you help me? I'd really like to get this published by this date or whatever. So it's really important to actually go and put yourself out there as well and to find those allies and speak to those allies because until you do that, you know, they may not even know that you're interested. Because don't forget, we're all surgeons, we're all really busy. So if you don't actually go and try and make that opportunity, then that's sort of a bit of a difficult thing. The other thing, which I think is also really important, is that when you have someone who's a female leader, it's really important to remember that, you know, the things that make us a good leader are also good followers. And so if you're got a female leader who's trying to make change or who's trying to bring things in to try and help them by following and trying to advocate and amplifying what they're saying so that those policies or those changes can come through. So I think that's when you said, you know, what can you do as a younger female that's coming out? Well, those are the things that you can do. You can help your leadership. You can amplify their good thoughts so that those things come to fruition. You know, things like flexible training, that wasn't just because one person stood up and said, we're going to do flexible training. That's because a whole raft of people came and said, that's great. How can we support you? What can we do? And so those are the ways that I see how you can slowly make change. But, you know, the honest truth is it's not going to happen really quickly. It's going to take time and persistence. And I think it's really important to encourage the younger women that are following us to see that we can make positive change and that you know, surgery is a great career. So that's one of the things that I say to everyone is I always say what a great career surgery is and really try and encourage our younger generation to follow.
Yeah, that's very important. So make a voice and listen. That voice is very different, very important. Thank you. So, how do you inspire others to be a champion in advancing gender equality in the surgical field? How do you think, Dr. Wexner?
You know, hopefully people get some of the infectious enthusiasm that I have and want to do the same thing. And part of it is seeing how incredibly proud, again, that's a great word for this webinar, but how proud I am of my women alumni, how they've done in their jobs around the world in leadership roles, and how often I continuously celebrate their triumphs and promote what they're doing and promote their careers. And I think others see, well, this is really has tremendous benefits because it pays off. I mean, you're developing leaders and great leaders, people who are really, really committed to what they're doing. And I think it's lead by example, basically. I mean, it's leading by example. It's saying, I'm going to do this and hopefully others are going to follow, which is just kind of the nature of life. You have to speak out. I mean, for example, you can't be quiet, and it could be on a local level. If you hear a comment, not just being silent, but speaking towards it and saying, that's inappropriate or what's going on here, but also at a public level. And I can tell you, as recently as earlier this year, I saw a webinar advertised from one of our societies, International Society University of Colorectal Surgeons, I think it was. And last year, the same thing at a Mexican meeting, with like this graphic of like, I don't remember how many, 8 or 9 men and no women. And I said, publicly to, my whatever, 40,000 almost followers, I said, well, seriously, question mark, exclamation point, in 2024, a mantle, you can't find a single woman. And then I suggested like 20 different women who I tagged, I said, what about, so, Lucia Oliveira, Giovanna da Silva, Dana Sands, whatever, just tagged a bunch of people who were capable. And I wasn't part of that meeting, but I mean, you have to call people out on these things. And when others see me doing that, hopefully they're going to do the same. And hopefully that's the way to extinguish these sort of behaviors and it's not necessarily malice, it's just lack of thought. It's lack of any thought as to what somebody's doing, not thinking, what is it going to look like? And I can tell you, I have, for that Mexican one, I was included and I didn't realize there were no women. And I publicly withdrew. I said, please remove me from your program in public, on social media. I said, please remove me from your program. I'm not participating in a mantle. And I listed a whole bunch of women colorectal surgeons that you can invite any of these people in my place, but I'm not participating, That's what you've got to do to push it forward. And hopefully then others follow suit. And I've more importantly now I've headed a few off at the pass where I've picked it up in advance and said, you can't do this. This isn't appropriate. Let's make these changes. And I'm not going to go into specifics because those people successfully changed it. There's no reason to call them out. But you've got to be reactive when you see it and proactive to prevent it happening. And others will follow suit because they say, that's really cool. That's an ally. That's an advocate. That's a sponsor.
Thank you very much.
I think it's really important to know your data as well. So one of the things is for us with training intakes is that they've all got to be reported with gender numbers. And then you've got to publicly report that at our big education board. So, you don't want to be, I would hope that most specialties don't want to be the specialty that haven't, that have only let in 1 or 2 women. So I think that's important, is that to have that public announcement of what you let into your training scheme. And I think when you're organizing conferences, to really make sure that the conveners know that we shouldn't be having manels, that we should be making sure that there's gender equity, not just chairing. One of the things that I've noticed sometimes is that people go, oh, but we do have a woman on the podium because they're chairing, but they haven't been invited to speak as a speaker. And I think that's really important, to make sure that you've got women up there who are actually presenting and speaking. I think the other thing also is that to encourage women to stand up for leadership positions, because sometimes women don't think that they're capable, or they don't think that they can manage, or they don't have the time. And sometimes that's true when you've got young kids and things, but especially as the kids are getting older, is to sort of say to somebody, hey, have you thought about running for that committee? I think you'd be great. And to actually encouraging that, because I think that's something that women don't tend to put themselves up unless someone actually says to them, you should apply for that. I think you'd be great. We're very good at giving other people kudos. We're very good at going to our friends and our colleagues and saying, hey, you're fantastic, you should do this. We don't tend to do it for ourselves, but we do tend to do it for other people. But I think that's really important, is to really go and support your fellow surgeons, your fellow women, and say you should do those leadership roles, and to really push people to do that and to take that leap of faith that you're going to be a good leader. So I think that's the way that you're going to make change, because you have to be in leadership positions to really champion the women that are coming behind you. And so that's important. And I always just say to people, look, you're already the best of the best when you become a surgeon, right? So that you've got all the skills, and so you can do it. So you really should move forward and get into those leadership roles.
Okay, that's great. Thank you all for this riveting discussion. We will now move on into our Q&A section of the webinar. So if you have any questions, please enter them in the Q&A box now. And I have one question from the audience. As surgical educators, what can we do to achieve better and fair opportunities for women interested in developing as surgeons? So please answer that question. Dr. Wexner?
Well, I think what what Dr. De Silva mentioned is great about the flexible curriculum. It's not something we have here in that same sense. And I'm very intrigued by that flexible curriculum. Certainly, we are more flexible than we used to be, but we don't have a flexible curriculum per se. And so I think you have to, again, make sure things are equitable and that everybody can be accommodated for what their needs are and given the chance to succeed. Again, it's along the lines of what we've been saying. If somebody wants to teach, ensuring they have the opportunity to teach, whether that's large groups or small groups. I think promoting education, one of my staff, Dr. Dana Sands, just sent her to she went to the Surgeons as Leaders courses and absolutely loved it. It was a great opportunity to develop. She has taken on developing our summer scholar program for high school and college students, getting them interested in pre-med careers. And it's not just for surgery, it's throughout the entire clinic for all specialties, internal medicine and nephrology, GI and radiology, whatever. It's championed that. And it's been great because here they see a woman who interestingly was our first pre-med student here at Cleveland Clinic, Florida, when we opened in the late 80s. She came around 1992 or so as a trainee, and now she runs this program. And so she's a phenomenal champion and role model, and we've given her the tools and promoted her and watched her succeed. And that's what you've got to do. You've got to find out what people want to do, help them get started, and then get out of their way and just support them and celebrate the successes. And I think education, that's a classic example. Get people in roles. So as Dr. De Silva mentioned earlier, the younger folks then have role models.
Okay.
I think that, we all remember, I would never do ONG because of the way I was treated by midwives. And I think that's really important, is to remember that we want to go into a place where, or become something that we see. And so that's really important, I think, when we're surgeons, especially when we have students that are coming, we want them to be surgeons. I think it's really important to give them this welcoming environment and to show them how wonderful surgery can be. So one of the things we know, when I have students in theatres, I always try to get them to be, come and see what we do, encourage them, show them all the things that we get to do, in my clinic, introduce them to the patients, get them involved so that they can see what life as a surgeon truly is like. And I think that's important, is to make it, change the behaviors that were there perhaps a few years ago. One of the things that I always say to my colleagues is, especially if women want to do surgery, the bane of my life is that when the first question that people get asked is, well, do you want to have children? because no one asks a man that question. If a man says, I want to be a surgeon, no one says, well, do you want to have kids? Whereas if you're a female and you say you want to be a surgeon, that's the first question most people will ask you. And so I think it's really important to just, show people that you can be a mom and you can be a surgeon. And so that's sort of, what I try to do is to just show people that there is, you can do both. So yeah, so I think it's just about making sure that people see the really good side of surgery and the fact that, we want to have and I think this is really important as well, is that I like to show my students how nice surgeons can be because I actually want nice people to be surgeons. I think the age of having surgeons who are, scalpel throwing, angry, swearing people in the theater, I think those days are long gone. And I think, we want to have a culture of tolerance, respect, and compassion. And that's the kind of surgeons that we all want to be. And that's another reason, that when we increase women in the workplace, is that we know that those behaviors are going to change, that the culture of medicine changes when you have more women in the community. And so these are all really good reasons why we really need to have gender equity in surgery. Now, it all starts from encouraging kids to be surgeons, to encourage girls to be surgeons.
Yeah, right. Okay, so the next question is, do you have in mind any opportunities or scholarships that favors underrepresented minorities in healthcare?
I'm not aware of any scholarships per se. I mean, certainly, again, the American College of Surgeons has many scholarships, including international travel scholars. And I think I would encourage people to apply because it's a phenomenal opportunity, not just to attend the annual clinical congress of the American College of Surgeons, but generally also to visit a few places before or after the annual clinical congress. That's one. I'm not sure about others. I can tell you that we have at the annual meeting that I do in Fort Lauderdale, we call a rectal meeting, which is just specific to my specialty and general surgeons. We do offer from the Smith family, we offer Smith surgical scholarships for trainees pretty much anywhere in the world, as well as any practicing surgeons from World Bank's tier 3 and 4 countries. So if a surgeon's coming from a World Bank tier 3 or 4 country, where underrepresentation of minorities may be even more acute because of a different healthcare system, we do give them scholarships to attend here. I'm not sure about others. I'm sure they exist.
Yes. So I'm sure American College of Surgeons have that scholarship for underrepresented minorities. Okay. So the next one is, what is advantages or disadvantage to get SHE at society level among HE? So Dr. De Silva, do you have?
So I think I'm going to take that question as, what are the advantages to get an equitable society level of surgeons and male and female? Well, I think that, first of all, I think it will bring out better patient outcomes. I think the more surgeons, female surgeons that we have, the better outcomes that we're going to have, because all the studies have shown that female surgeons have better outcomes than male surgeons. And I don't think that's because necessarily women are just better than men. I think it is because we have different qualities that we bring in. And when we bring those qualities, we also teach them to our male students. We teach our male trainees things that we do better. And so that's going to propagate better quality surgical care throughout both genders. And so I think that's going to be an advantage. I think that we do things differently, and sometimes we think about things differently. And I think that's important to see that. We have a different worldview. Men think about things differently to women sometimes. And so it's really important when you're discussing a patient. And it's really interesting when, we had a patient that, responded in a sort of with some mental health issues when she was examined. And, one of the women in the room said, perhaps she was sexually assaulted. And none of the men had even thought about that. And that's because we all come from a very different background and we have different worldviews. So it's important to have that mix of diversity in the room. So that's definitely the advantage. I don't think there's a disadvantage. I think, you know, primarily the people that see it as a disadvantage are the people that have always had advantages. And so when you take away that little bit of privilege, then that becomes a loss of privilege for them. But I don't think that there is a disadvantage to having gender equity. I think that's really important.
Yes, right. Okay, so the next question is, in a world where a successful female surgeon is sabotaged by her male colleagues for being better than him, how can I help the female surgeons overcome issues of this type?
Well, that can be, I'm not sure what's meant by sabotage, but if it's what I'm thinking it is, it shouldn't be tolerated by the department chair at all. And that's where, that's beyond the level um, of just talking to somebody. That's actionable. I mean, whether somebody has to be on a performance improvement plan or some other form of behavioral modification, or if the behavior is not modifiable, you don't want somebody like that in your department, right? I mean, you don't want somebody who's sabotaging anyone, woman or otherwise. And if it is the department chair that's doing it, then you end up going to whoever is above the department chair and speaking to that person, because that kind of behavior is just plain unacceptable. The problem is only if the female surgeon, as worded in the question there, doesn't speak up and keeps it to herself and doesn't let people know it's happening. And that'd be the only problem, because then you can't address it and fix it because you don't know what's happening. So one is speaking out without fear of retribution is key. And you have to have a work environment, or in the case of a society environment where people know that they're welcome to come forward with grievances like that without any fear of retribution. That's critical. And that gets back to our earlier discussion about having a warm, welcoming, hospitable environment, accommodating everyone. And people know that they can speak up. Then you could act upon what you're told and say, okay, let's figure out what's going on. We'll have whatever investigation is necessary and we'll take whatever steps are necessary, because sabotaging anyone is just plain unacceptable.
Mm. And I think there's many different ways to answer that. I think it's going to depend on where you are, what kind of where the person is, where that male surgeon is in the hierarchy. It depends on, what kind of hierarchical situation you're in. Absolutely, if you can call it out, you should. But if you can't, then that's where a lot of women sometimes find themselves, because they do feel that there's that fear of calling somebody out. I think the first thing that I would do in that situation is, first of all, do your audit. Look at your numbers, look at your statistics. Bring that out at a meeting and say, why don't we do an audit of all of these operations? Let's have a look and see what our department's doing. And so present all of that at an open meeting so that there's very clearly shows what the rates of complications or morbidity mortality is. So that's the first way I would deal with that. The next thing is that if it's not yourself and you are another surgeon in that unit, is to maybe go and have a little chat with that male surgeon and just, have a cup of coffee conversation with them and say, hey, I've noticed that you've been kind of saying these things. I'm sure you don't really mean it the way it's coming across, and calling them out quietly and privately and seeing if that actually makes them, take a step back because they've suddenly realized that someone's calling them out. Um, if you're in a position though, then to actually take that to somebody who's more senior to have that actually formally actioned, then absolutely that's the next step that you should do, is to make sure that this person's formally actioned. But it is very sometimes difficult when that person might be a person who is in the hierarchy above you and you're scared to call them out because you think it's going to reflect badly on you. If those are the cases, if that is the thing, you have to find your allies. So you need to start finding out who is your allies. You need to make sure that people know that this is what's happening, and do it quietly so that people know that when this person starts saying things that they can say, hey, really, is that true? And so that's what you have to do. That's the way I would deal with it. But I totally agree with Dr. Wexner that you do have to stand up for yourself and you really do have to call it out. You have to show some courage because, if you are in the position of right, then, you do have to stand up for yourself.
Yeah. And again, that becomes our job too, because maybe the
Mm.
person in question, the person who raised the question doesn't want to necessarily bring it out herself, right? So then she should come to a male, ideally somebody senior, who will support the view and let that person have the conversations if that's more comfortable, as long as it gets addressed. The worst thing is if you let it fester, because if you don't deal with it, it will worsen, because it empowers whoever is being the bully to continue bullying, because nobody is spanking them and nobody's saying, let's stop, you got to do this, and calling them in the principal's office and saying, sit down, this is what we need to do, this is your action, your performance improvement plan. So you just cannot let it lie dormant.
Okay, thank you. So that's all from the Q&A from audience right now. So I have one more question about how to make for example, talking about making the new curriculum or something, the new one. How do you create the voice, the new voice, and how to make the next step? Because if you're a junior position, it's very difficult to make the new system or something. So how do you make a voice that new idea? Or
Yeah.
I
Go
think
ahead.
you should, so if you have a new idea and there's something that you want to change and you think that there's something that might be good, I think first of all, you need to really think about what it is that you want to achieve and make sure that you have a really clear plan of action. And then think about who's the best person who's going to make that happen. And that's the person that you need to. So you need to really be clear, have a plan, and then decide, right, this is what I want. Who are the people that can help me achieve this? And then you need to approach those people and say, hey, this is what I'm thinking. How can you help? So you need to actually have that clear plan of action so that you have those people that you can approach, whether they're people within your department, whether they're people in other departments who might then go and speak to the heads of your department if you think that your department might not agree with the changes that you want to bring in. So I think that's, you can either do the direct approach or you can do the sort of round approach where you get your allies from other departments that can also come and speak to your seniors. And I think that it's really important. I mean, in Australia, we always say if you got to have a business plan, right? You've got to show how this is going to improve whatever it is that you're going to improve. Because if you've got a new idea or you've got a new way that you want to do things, it's got to be something that's going to be better than the status quo. So you've got to really show how that's going to improve. And if you can show that, and then, you should always be like enthusiastic and try and really push your idea. And, it's also persistence. If you're not persistent about an idea, then people will sort of let it go. And so I think it's really important when you want to raise a new idea is to show that persistence, politely persist with whatever your idea is to try and get it forward.
I think the societies also, as you mentioned, for example, in Australia, New Zealand, that you have a Women in Surgery Society, Women in Vascular Surgery, Women in Thoracic Surgery. As you look around the world, the European Society of Coloproctology has a young ESCP, men and women. Royal College of Surgeons of Ireland has women in surgery in Kuwait. I mean, there's more and more forming around the world. And societies can sometimes, if not always, have a bigger voice than individuals. And when you have societies formed, and ideally they're allied, like through Royal Australasian College of Surgeons or through the American College of Surgeons, they're very much empowered by the parent body, by the ACS or RACs, to to report to the governing body, to Board of Regents and Officers in our case, and to allow us to act as appropriate on the issues, as well as to include people from those groups in planning as you go forward. So to include people in committees, to include people when you're drafting white papers and creating publications, to include people from those groups when you're creating program content for meetings, all of the above. So having a group, a society, helps ensure putting that behavior forward and helps us ensure that it's constantly front and center around the table during the discussion, so it's not inadvertently left out. So in other words, people aren't left out, but the agenda item isn't left out, and therefore the people aren't left out.
Thank you. So one more question from the audience. Do you think these types of behavioral changes should begin in medical schools?
Ideally before medical school. I think it's societal. And as I mentioned, we have a program here that Dana Sands runs, starts with high school students, which is before, again, the US, the system is different than most of the world, that we have university and then medical school. But even in high school, the behaviors need to begin. And in part, it's by people demonstrating surgery, as Dr. Silva has a great career. You want to become a surgeon at a very young age. But it's also behavioral changes for society. And I find myself many times talking to patients because, oh, Dr. So-and-so looks, really young. I mean, I've yet to hear them say that about a man in my entire career. You've got to say, listen, they're superb. I'd have them operate on me or my family, and they're, worse yet, when they say nurse, it's not a nurse, it's a surgeon, and so I mean, that's society. That's beyond medical school, residency, or practice. That's just people have these ideas in their heads that are very sometimes difficult to change, and that is something we again need constant vigilance and constant correction. So I think it should change before medical school, and I think it needs to continue to change on a societal level more so than just within the healthcare industry.
Okay.
I think that's really important that, we encourage that whole cultural change all the way through medical school as well. Absolutely. I think that, there's certainly behaviors that I sometimes see in medical students that I, and I call out and say, well, why would you do that? Or why would you say that? Because they sort of parrot exactly what Dr. Wexner was saying. They parrot what they see in society. And it's really important to call them out on those kind of behaviors if they're behaving badly as students. And in terms of encouraging people right from medical school or from high school, we do that in Australia. We have in my private hospital, we run an evening for high school girls in year 10. So they all have to choose their subjects for high school, which for year 11 and year 12, which is when they choose the subjects that would help them get into medicine. And so we talk to them about, why you should come and be a surgeon, and show them some cool videos and things just to really encourage them to think about it. And so that's what we do. So I think that's it's sort of encouraging people. And nearly hopefully a lot of people that are on this webinar, you're all role models, and you'll all be showing the way to all the women that come behind you. And so that's really important. So I think that's why these kind of events, and to have, increasing gender equity really helps, because the more women, when I was a medical student, we didn't have a single female surgeon at the hospital where I trained. And so I really love the fact that I work in a hospital now where we've got quite a few women surgeons, and we sometimes will be in theatre and there'll be like 3 or 4 female surgeons in theatre, which is amazing for when I think about what it was like when I was a medical student. So hopefully as more and more women become surgeons, it'll just become normal, and these kind of things will not be as needed, hopefully.
Thank you very much. So we all have to have the voice and the strength to listen to the voice, so that we can be, everybody can be a champion. So today I'm very glad So I'm very glad to have the exciting discussion today. Thank you. So I will now turn it over to Jessie for final announcement. Thank you very much for the exciting conversation.
Thank you.
Thank you, Dr. Kwase, and thank you, Dr. Wexner and Dr. De Silva, again, for an enlightening conversation and to take your time to share this knowledge with us. With that, I wanted to just remind everyone that this webinar has been recorded and will be posted to the ACS YouTube page under the Global Surgery playlist, and it will be posted after the webinar. We will send an email out once that recording has been posted. As mentioned during this webinar, it starts at education. So I just wanted to remind everyone that this year residents can become members of the American College of Surgeons for free and access our full benefits. Lastly, if you have any questions, feedback, or ideas for future webinars, please contact me or any of the IRC staff. Our information is on the screen. Thank you again, everyone, for joining us today. We hope you have a wonderful day. Bye-bye.
Thank you.
Bye.
Thanks. Bye.
Bye.